Greetings. Welcome, Marita Hattem-Schiffman. Thank you for taking this time. We've been working together in this group that is developing the strategic plan for Alma and helping to facilitate that work. And it occurred to me and many others it'd be great to have an opportunity to visit with you and talk about the hospital's planning and preparation for this global pandemic and give us a sense, too, for what the weeks and months ahead look like. Marita Hattem-Schiffman is president of MidMichigan Medical Centers in Gratiot and Mt and a graduate of CMU. And I noted English and psychology. I did not realize that until just now. And then University of St. Francis, MBA as well. You've been with us since 2017, Marita?
Yeah, July of 2017.
Our community is very fortunate to have you here. Thank you for all you do. Well, how are you and your family doing amidst this crisis?
We're doing pretty well. It's just Randy and I and the dogs at home, and with family far flung between Chicago and Florida. And it's been really hard not to be able to see them, but we're very proud of all of them for social distancing the way they should be and using grocery delivery services and all that. So at least we know our families are safe and we don't have to worry about them.
Well, I'm glad for that. These tough days for our community, for communities around the globe. I know you knowing you these 3 years to be a very optimistic person. How do you maintain that spirit in the face of all this?
To begin with, just in our community, we're surrounded by so many people who care and are willing to do whatever it takes, regardless of what we're facing. And I start really with the team at MidMichigan Health. They have just been amazing and a huge source of mutual strength for each other. And we've known as this whole pandemic has been predicted one way and then swung another, and every day is a new challenge. But we've known from day one that working together, we would be able to meet whatever was required of us. And the community has been so amazing in their support. It literally has felt like a giant hug right now. And in healthcare, we're huggers, and it's driving us crazy that we can't hug each other and we can't hug our patients. And these gestures from the community have felt like that hug, which has been great. And then, of course, my faith has been amazing in this, especially early on when we really thought we were going to be completely overwhelmed and have to make some really tough decisions. And I remembered that the book that most influenced my life as a kid was The Hiding Place by Corrie ten Boom. Mm-hmm. And she was a middle-aged woman that got all brought into World War II and rescuing people and defying things that had been the norm her entire life. But God gave her exactly what she needed in terms of skills and resilience right when she needed it. And then when she didn't need it anymore, he took that away again. And coming into this, I just had to believe that he would do the same for all of us.
Do you think a time like this changes our sense of meaning, of impact, of purpose, and for individuals, for our community?
I definitely think so. By luck, I came across a book called A Paradise Built in Hell. It's back from 2010, but I came across that. I think I read about it in the Harvard Business Review article. And the author goes back and looks at all these very well-known disasters and things that have happened over time. And she points out that every single time, the best of humanity and altruism arises in those situations. And I have to believe that even though we're facing health tragedy right now and economic tragedy, based on what she's found in her research and all of these other situations, our best selves will emerge, and as a community and as a region, we'll recover, and it'll be a new normal. But I hope that we recover to, and I believe that we'll recover to something that's better than the old normal that we had.
All of us in this community look to you, to your to doctors at the hospital, the nurses, all the staff, and just selfless giving that everyone there has done to ensure that our community is safe. We've certainly seen a lot of expressions of support, but are there other ways that we can support the healthcare professionals at the hospital?
The things that people have done for us already, the food, the donated supplies, the prayer, the expressions outside of our hospital, the signs, the sidewalk art has been absolutely amazing. That said, to support us going forward, there's really two things I want to emphasize. And one of them is following the governor's orders. They're designed to prevent the spread of infection. And if we each do our part, our healthcare team will never have to face the devastating things that we've seen happening in other places on television. It saves lives. And I want to take a minute to really focus on masking, because that seems to be getting a lot of emotional response in different communities. We need people to understand that wearing a mask is not about you preventing getting the infection yourself. It's about making sure that if you have the infection, you're not giving it to others. So you're not masking to protect yourself, you're masking to protect the rest of us. 25% or more of us do have COVID-19 and we don't know it because we're asymptomatic, which is a really good thing. But asymptomatic people can spread the disease to others. So we ask you to mask so that if you're one of those people, you don't give that disease to other people, because it is deadly for a small percentage of people in our community. And that's unnecessary to see people get so sick and to potentially die. The other thing that you can do to support healthcare workers right now is make sure that you're getting the healthcare that you need. A lot of people have put off healthcare in order to give us the operational capacity to deal with a surge. Well, we didn't get a surge, and that's a great thing. But we keep hearing now that community members are afraid that if they come to a doctor's office or an emergency room, that COVID-19 must be there and they'll catch the disease from our facilities or from us. Please know that we are the experts at preventing the spread of infection. We do it every day. Our practices with COVID-19 really aren't any different. It's just that COVID-19 is more prevalent and no one has immunity to it yet, is what's raising the profile of it. But we've redesigned our physician practices, our emergency rooms, our hospitals, even more so to prevent people who are symptomatic and may have COVID-19 from coming in contact with those who are seeking care for something that's not related to that. You're probably safer in a doctor's office or one of our hospitals than you are, frankly, in a store right now. And if people delay preventative care, if they delay diagnostic testing, they fail to treat an active injury or an illness, that reduces the likelihood of a great outcome. We're prepared to take care of everybody, and we just need people to keep seeking that care for their own well-being.
The governor's order is extended to May 15th. How does that extension affect the hospital, and what do you anticipate once we do begin to move away from shelter in place?
We're kind of waiting to see if she amends any more orders specific to healthcare. We have been providing what we call essential services all along. So that would be maybe a person who has nothing to do with COVID-19, but they have a health condition that if we leave it alone for 2 to 4 weeks or whatever length of time the order lasts, that person's health could be negatively impacted. And now that the time has gone on as far as it has, we've got a lot more people that maybe 6 weeks ago could wait, but they can't wait any longer. So we're really trying to reach out to those patients, and we're looking to them to reach out to us so we know how they're doing, so we can get them into the care that they need. We have added a lot of practices to prevent particularly asymptomatic people from coming into our facilities with virus. So if you've been to any of our facilities, you may notice we have signs that say, if you have any of these symptoms, please go back to your car and call us, and we'll come out to you and we'll figure out what's going on with you. And if we think you might be symptomatic for COVID-19, we're going to take you to a different part of our organization where we can keep you separate from the rest, and we'll take care of you there. We'll continue to do that. Visitors that come to the door that they're there for something other than an emergency visit, or they're there for a test or something, we screen them. If they're asymptomatic, we give them a mask to wear, again, just in case they may have the infection. We don't want them to give it to others. We'll probably continue all of those practices until we really feel like the virus has moved through most of our community. That's probably what will be the most biggest change that people see in the hospitals. But again, we're experts at dealing with infections, so there's a lot that has continued to be normal for us that will continue to be normal for us.
So we've had, you noted we didn't face the surge in Gratiot or in MidMichigan. I think Gratiot's, as of today, 13 cases and 1 death. And difficult as that is, we recognize it's not the level of crisis that so many communities have faced. Should we anticipate a second wave or a third wave or a surge coming that we've so far avoided?
There's a lot of opinions out there on that. If we're all watching the news, I know, and you can go to one station, hear somebody say one thing and then change the channel, and there's another equally incredible looking expert that's saying the exact opposite. So to the degree that I could predict what do I think our greatest risks are right now, I think for our communities in Central Michigan, we're most at risk of an outbreak of one infected individual being around a lot of people that are not social distancing, maybe a big party or a nursing home where people live closely together. It just takes one person and they can spread that infection pretty rapidly. So that's really what we're watching for. at the hospital at Gratiot, we were prepared to more than double our critical care capacity, more than double our number of acute care beds. And it's kind of a good thing that we have this brand new state-of-the-art tower, and right behind it is the old hospital. That gave us a lot of flexibility to see patients. We had scaled all that up and we're about ready to start working on the staffing plans when the flattening happened, and we realized we didn't have to surge that much. But we're still keeping those extra parts of the facility active in case we do have an outbreak from an isolated situation. Then we'd have a unit where we could put those patients and keep them isolated if we needed to. But we've got so much flexibility now on how we can take great care of all types of patients. We're just really proud of the innovation that happened and the creativity and the resolve of the team to make those things happen, that we know we can deal with whatever comes.
Well, we're all the beneficiaries of the work that you did and continue to do. What do you see for the hospital and perhaps for hospitals generally? Obviously, this has been an enormous financial hit for so many, and then with the loss of elective procedures, of course, that's the largest part of that. But how does this change the work that hospitals do going forward?
Yeah, I think we're going to be much better at doing virtual care. One of the early things we did to segregate patients was we set up a telehub so that anybody could call the telehub and say, hey, I've got these symptoms, I'm concerned. Physicians and other providers would screen those symptoms and decide if that patient needed a test or not. A lot of the stories I heard from that was most people were calling, they didn't have COVID, they had strep, they had flu, things like that. And we were able to reassure a lot of people, and they never had to leave their home. Then most of our physician offices in about a 3-week time frame switched over to almost all virtual visits. So patients didn't have to come in person. And what's ironic about that is that was one of our goals for this year. And we were already forecasting we weren't going to meet the goal. And it's amazing how innovative you can get when circumstances dictate that you have a different priority or you move your resources in a different way. And I think we'll continue to do those things. And some of it will go back to the old normal, but most of it will stay that way. Financially, it is probably our biggest concern, and it's been a struggle because everyone is worried about the economy. We get the luxury of worrying about health first, but the economics that are happening are devastating healthcare as an industry, especially our rural hospitals, as much as anyone. And we've got a small team that is constantly looking at that so that we can keep focusing on clinical care and especially keeping our employees safe and making sure their needs are being met. But given a couple more weeks, as we start to look at what's happened to our bottom line, it is concerning. And it kind of goes back to people returning to us to get the care that they need, non-COVID related. Patients, we were growing like crazy and patients needed our services. The more that patients return to get those services, that's patient volume that creates hours that our staff needs to work to serve those patients. And that means that our people have jobs. And that's really where I'm focusing, is how do we keep the jobs alive and vital and active in our community and have things for our people to do. And I think that will solve a lot of the problems that we're worrying about having right now.
So certainly so. We're facing that at the college, and likewise our faculty, as your doctors, turn things on a dime to suddenly be online. I think every entity in our community and communities across the globe has had to change in response. Well, yeah, the hospital's made incredible change, and we're so grateful for your leadership and for the work of all there. As we think about what that new normal is beyond the hospital and in our community, do you foresee what's happened in Asia, where masks are just a normal part of everyday life? Is that where we're going? With the threat of future waves or future pandemics, what's your sense?
Well, one thing is, I hope that everybody's finally figured out that they got to wash their hands. Every year flu season comes around and we beg people to wash their hands and we beg people to cover their cough by coughing into their arm and all of that. And a huge percentage of people just don't get it.
Right.
I think this may have tipped us over that we'll all be hand washers going forward. I hope we don't have to mask, but that may be part of our reality, at least when flu season comes around every year. But I find myself smiling constantly as I'm doing this anyway. We're all smilers, and in America, we communicate with our body language. And right now, we're all masked when we're outside of our offices at work, and it's really hard to read if people are smiling or worrying. And we need to have our body language to be able to communicate with each other. So I hope that masking isn't a part of our long-term future, or at least only when it's necessary. I sure hope that we treasure our relationships and our freedoms better after this. and that we don't let this make us live in fear and isolate ourselves, that would be a tragedy for us. That's not who we are. We're communities that are warm and caring and together and expressive. And if we lose that, I think it will fundamentally change us. And I don't think necessarily for the better. We're learning to be more innovative. We're learning about what really is important in our lives and what isn't. And I really hope we carry that on and let that change us for the better over time.
Well, Marita, we're so grateful, all of us in this community, for your leadership, for the work that all the healthcare professionals at the hospital are doing. Thank you, and I'm grateful for this time to talk with you today.
Well, thank you, Jeff, and thank you for all you're doing. And I can't let the moment go and not thank you for allowing our staff and our physicians to use facilities at Alma College and without charge, which is absolutely amazing. That has given so much comfort to very weary workers and people who are concerned that they have people in their families that could be at risk with COVID-19. And it's just made all the difference in the world for our employees feeling safe and cared for. So thank you for that and for everything you're doing to lead our community.
Well, we've got a great partnership between Alma College and the hospital, and we're grateful for that. Our nursing program's been in that hospital for the last 5 years, and you all likewise make that possible at no charge. We're very grateful. It's an important partnership for our community, and I'm grateful for it. Well, thanks so much for your time today.
Thank you. Take care.
You as well, Marita.